smiling.
First impressions are priceless.
I'm Dr. Kenny Levine. For the past 37 years, we've been helping patients of all ages restore their smiles. Today, with modern technology and lasers, we're able to treat infants of 7 days old. We treat their parents. We help them not only keep their teeth, but restore function for the rest of their lives.
Call 954-603-7109.
I'm Dr. Kenny Levine. Welcome back to Health Talk. I'm here with Dr. Brad Ginzler. Brad, we were talking before about the preservation of the internal aspect of the tooth. So Brad, tell me a little bit about how you actually preserve the tooth structure inside the tooth.
So by using a surgical operating microscope, I am able to limit the amount of tooth structure that I cut. My access preparation, as a result, can go from 3 to 4 millimeters down to 1 to 2 millimeters, and that's a significant difference.
What's the magnification of your microscope?
It can go from 0.3 times to 20 times. The significance is considerable.
In typical work that you do, what's the magnification that you use?
I'm probably working at a 3-time magnification, which when you're talking about 1/4 and 1/2 millimeters, that's substantial.
I know when I do my surgery now, I use 4.8 magnification with the headlight, so I can see things I certainly couldn't have seen with my naked eye, and the precision of my treatment is a lot better with the magnification. Is there a light associated with what you do?
Absolutely, and the microscopes today have different types of lights. There's metal halide, halogen. I personally use an LED light that's really white, and that too allows us to see much deeper into the canals and locate canals that may have been missed otherwise.
Now, once you've located the canal, and I know you clean and you sterilize the inside of the canal, what do you put inside the canal?
As far as the obturation material?
Yes.
Today the standard still seems to be gutta-percha and sealer.
Okay. There's also a surgical aspect to root canal therapy.
Absolutely.
And at what point do you decide that the traditional root canal, even with a microscope, is insufficient and you need to do a surgical procedure?
See, I think that I'm on one end of that argument, and I tend to not do a lot of surgery in my practice. I try to retreat previously treated root canals that haven't worked. My goal is to keep the inside of the tooth as clean as possible from the coronal aspect to the apical aspect.
That's from the top of the tooth to the tip of the root?
Correct.
Okay.
And so what I found in doing surgery, sometimes it's like putting a patch on a more significant problem. I prefer to retreat the teeth. So I do a very limited number of surgeries. And I think that that's a trend that I've learned through, as I was talking about the group TDO, and limiting the amount of cutting that we're doing. Because again, as I had mentioned, once I cut a tooth or cut the bone, I can't really uncut that. So if I can limit the amount of surgery that I'm doing, I feel like that's better preservation of the tooth.
Now, with the use of the microscope, I know you can see better inside the tooth. Previously treated root canals, do you often find parts of the root of the tooth that weren't treated before, or other roots that weren't treated?
So in addition to using the microscope, and to answer that question is yes, we definitely can find canals that were maybe missed by a previous practitioner. In addition to that, in my practice, I have a cone beam CT scan machine, a limited field view CT scanner, and the radiation dose is so low that I'm comfortable using it with regularity. The use of this machine not only allows me to 2-dimensionally view a tooth, but I can also now 3-dimensionally examine what's inside the tooth, and I can anticipate where a missed canal may have been. Then with that information, take that to the microscope and then see here's where I need to go specifically and get there to clean out the infected canal that may have been missed before.
We're going to come back to the cone beam CT in just a moment because I know it's helped me in my cases. I'm Dr. Kenny Levine with Health Talk. We'll be back in just a moment. Thank you.
When you're smiling.
First impressions are priceless.
I'm Dr. Kenny Levine. For the past 37 years, we've been helping patients of all ages restore their smiles. Today, with modern technology and lasers, we're able to treat infants of 7 days old. We treat their parents. We help them not only keep their teeth, but restore function for the rest of their lives.
Call 954-603-7109.
Hi, I'm Dr. Kenneth Levine, host of Health Talk. Whatever you wanted to know about your medical, dental, or wellness care is going to be covered on our show, which is going to show at 6:30 to 7 on Tuesdays and Thursdays.